Today we'll be discussing with dental emergencies in pediatric dentistry. Now, what is an emergency? An emergency is a sudden occurrence which can occur anywhere, anytime, with or without warning. So sometimes it is also a life-threatening situation. There are certain type of medical or dental emergencies which happen most often in the dental office during the time of the dental procedure or the dental operatory. The maximum type of dental emergencies occur while the patient is being operated. Then lesser than that, after the dental operation, dental emergencies or medical emergencies occur, and the minimum amount or the minimum number of dental emergencies occur in the waiting room. According to American Dental Association, approximately 3,000 of the medical emergencies occur every year. Now, what is a medical emergency? A medical or a dental emergency is any unforeseen circumstances or a group of circumstances which require immediate action. It also leads to sudden bodily alterations like jerking of the movements of the body, jerking of head, immediate discharge of fluids from the mouth. So these require and likely to require medical attention, which is immediate. So a doctor or a clinician should be smart enough to recognize a dental emergency or a medical emergency, then act accordingly for the remedy of the same. Then the root cause of the emergency should also be located and find it out. McCarthy stated certain guidelines or certain questionnaire which should be asked the question before starting of any medical or dental procedure. The questions are such as: were you hospitalized before, or do you take any medications, or you are previously taking any medications for a year or two, or do you bleed excessively after a cut or a wound and the bleeding does not stop after some time, or are you allergic to certain medications, or you are suffering from any medical condition which is not recorded here, or you are taking any nervous breakdown, or you are feeling any anxiety, any pain during the medical or dental procedure, or you had a past unpleasant dental or medical procedure. So these were the questions which need to be asked to the patient before operating the patient. This can avoid or are likely to avoid any dental emergencies. Now, before starting of any dental procedure, there are various vital signs which need to be recorded. These are the basic features which need to be recorded before starting any procedure, like the temperature. If the temperature of the patient is above 104 degrees Fahrenheit, then no dental procedure should be operated. If the pulse rate is high, for example in the case of fever, then also any dental procedure is postponed. In the case of tachyapnea or bradyapnea, that is shallow or decreased respiration, or in the case of increased respiration, which is generally found in alkalosis and fever, the dental procedure can be postponed. Now, even the blood pressure, if the patient is suffering from a high blood pressure, the patient is a blood pressure patient, then the dental procedures need to be operated very carefully, and in each and every step the procedure, the blood pressure needs to be monitored. If the person is suffering from hypertension, medical consultation is also necessary before operating any procedure on the patient. For example, if the person is hypertensive, that is, if the person is having a systolic blood pressure more than 210 mm of Hg, then we usually postpone any dental procedure and only emergency procedures are performed. That also even after the consultation by a physician. If the systolic blood pressure is less than 210, like it is between 140 to 159, and the diastolic is between 90 to 99, then elective dental procedures, certain selective procedures which are non-invasive, can be performed on the patient. And in the case of normal hypertension, that is if its systolic is between or below 139 and diastolic is below 89, then the dental procedures can be performed easily without any contraindications. Now, there are certain steps which need to be prepared before any emergency procedure. For example, if an emergency has taken place, then we call for immediate help. A recognition of emergency should be there. That is, for example, in the case of epilepsy, which is a medical emergency, one should recognize that this is a epileptic attack on the patient which has happened after the dental procedure is operated. So first, quick recognition is necessary. Then even after quick recognition, early response to the recognized dental or medical emergency should be there. Then further, we provide with the basic life support, and advanced definitive care should be given to the patient. Now, as there is certain ABCD of the dental emergencies which need to be performed. Step 1 is the recognition or the assessment of the emergency. Step 2 is terminate of any dental procedures which are taking place on the patient and remove all the instruments from the vicinity. Immediately we should stop the dental procedure. Then we call for help. Then we position the patient in the most comfortable posture or in the Trendelenburg or a supine position. Then we go for airway assessment, that is the patient is breathing properly or not. If the patient is not breathing properly, then external respiration is provided to the patient. Then we go for assessing of the circulation of the patient, that stands for C, which can be assessed by the means of radial or the brachial artery, that the patient has proper blood supply to the extremities and to the brain. Then the definitive management for any emergency procedure should be done. This is a basic life support pattern. So, how to position the patient in the case of emergency? First, it should be kept in the mind that the patient should be kept in the most comfortable position after the emergency has taken place. There are certain comfortable positions, like the patient has to rest his head on the arm leaning on the chair. This was one of the comfortable position. Second, if the assistant is there, then we can position the patient in the supine position on the dental chair, or in the Trendelenburg position, that is the feet elevated and the head lowered, so that there is more of blood supply to the brain for the patient to get conscious and activated. So the patient should be in the most comfortable position where whatsoever is required. Now, how to maintain the airway of the patient? There are certain techniques. First is the chin lift and the head tilt procedure, in which by one arm or one hand we tilt the head of the patient backwards and upwards, and we tilt the chin and we pull the chin of the patient down, so that the patient is able to breathe from the mouth. Then there is another procedure where the head is tilted and the jaw is thrusted forward, so that the patient can breathe through mouth and maintain its airway, and then further maintain the circulation or the blood supply to the brain. Then we can also go for artificial respiration or mouth-to-mouth breathing. There is a certain frequency according to which the mouth-to-mouth breathing should be given. It should be given in adult every 5 per 5 second, like 1 per 5 second. That means 12 per minute. In the case of children, it should be 1 per 4 seconds, that is 15 per minute, and so on the case of the children. So the mouth-to-mouth breathing, transfer of infection is mandatory. So it should be we can also use an instrument which is used for mouth-to-mouth breathing. Then in infants and children, we generally go for a thrust of the chest procedure for maintaining the CPR or maintaining the circulation, where the hands are kept over the sternal region and they are thrusted into the chest, so that the circulation is maintained. Now, there are certain common emergencies which happen in a dental office. They are unconsciousness or syncope, and then in the case of asthma or respiratory distress, then seizures or any LA overdose or any allergy. We'll be discussing with syncope. First, syncope is a loss of consciousness basically due to cerebral ischemia or poor blood supply to the brain. There are different type of syncopes like vasopressor, then vasovagal, common faint type of syncope. Now, what are the causes for syncope? There are certain psychogenic and non-psychogenic causes. The psychogenic causes include if there is any stressful situation, or in the case of excessive fear, or in the case of anticipation of excessive anxiety by the patient, or in the response to any unwelcomed news. For example, in the case of shock or any like the news of the death, etc. Or in the case of the sight of the blood of the young doctors who are going for dissection, suppose they are exposed to blood sight, or in the case of any accidents on the road, if there's a child or a person who is very sensitive who is exposed to such visions can go through a syncopic procedure. Then in the case of non-psychogenic factors such as poor diet, poor breakfast, then long standing hours standing in the sun, or in the case of hot humid climate, then excessive exhaustion or loss of energy, and the age between 16 to 35 years of age. Now, what is the management of such type of syncope? Basically, first of all, we recognize the medical emergency, that recognize the patient will be going into the syncopic state. Then after recognizing, we stop all the dental procedures and keep all the dental instruments away from the patient, and we position the patient in the most comfortable or the Treadlenberg position. That is, the feet of the patient should be elevated and the head should be lowered so that there is more transfer of blood to the head region, and decrease of the cerebral ischemia will take place by such procedure. Then we go for a definitive care. For example, if even after such administration or doing such procedures the patient is not back to consciousness, we give the patient artificial ammonia or ammonia by inhalation, or administer oxygen to the patient. We also administer patient with atropine if bradycardia or decreased heart rate or cardiac output is there. Next is a case of foreign body obstruction. Now there are certain procedures. For example, if the rubber dam is not used properly, then there's a chance that certain small instruments like files, then cotton rolls, then swabs, and even the rubber dam clamps, they all can fall into the posterior part of the oral cavity. Sometimes even after the extraction of the tooth, and if the tooth slips from the forceps, the tooth can also fall into the oral cavity posterior segment and then later into the pharynx and the esophagus, or it can travel to the trachea or the bronchi in the respiratory tract. There are also chances of certain small flosses pieces or file pieces or brooch pieces to fall. Even the fragments of fillings like amalgam filling, composite filling, the stainless steel crown can also slip back into the oral cavity. Now, how can these be avoided from slipping back? We can use a cotton gauze pack into the posterior segment or the oral cavity, or by using a rubber dam, or by using of aspirators, etc. We can prevent these small instruments from falling back into the oral cavity. Now, there are certain signs and symptoms for the partial obstruction of the respiratory tract and the complete obstruction of the tract. In the case of the partial obstruction, the patient will be able to breathe partially and can also speak in the broken voice. And there is certain forced cough which leads to expulsion of the object from the respiratory tract. They can be wheezing or crowing sound from the oral cavity. The voice of the patient will be altered, and there is a possible cyanosis due to decreased of oxygen to the extremities and various organs of the body. There can be cyanosis of the nail beds too. In the case of complete obstruction, there will be no voice, no sound, but a choking sign, and the patient will grasp his neck from both the hands. This is a choking sign, and the patient will not able to speak, the patient will not be able to breathe or cough, and the patient will be in complete panicky situation, and a complete cyanosis will be there. Now, I've already told how can this be prevented by the means of gauze pads, by the means of oral packing, then proper chair position, proper use of rubber dam, then mechanical intubation forceps, and by the means of ligatures, by means of attaching floss to the dental instruments, etc. We can prevent the falling of the instrument into posterior portion of the oral cavity. Now, what will happen if the instrument or certain fillings fall into the posterior part? For example, if the assistant is there, we can position the patient in the Treadlenburg position, and by the means of the mechanical intubation forceps, we can withdraw the instrument from the posterior part of the oral cavity. But what if the assistant is not there? We'll ask the patient to cough forcefully and position the patient in the most comfortable position, like resting his arm or on the chair head and resting in his head on the arm. Then finally we'll ask the patient to cough so that to expel any foreign object which he has or she has inhaled. Then if the object is swallowed, then we'll go for radiologist, consult the radiologist, and we'll get the body scanned and find the location of the object which can be further operated. Now what happens if the object enters the trachea, which can further enter into the bronchi also? The first step is we'll encourage the patient to cough out. If the object is retrieved, we'll go for the medical consultation before the discharge. Now if the object is not retrieved, we'll go for radiologic investigation. We'll consult a radiologist, and from the bronchoscopy we can retrieve the object back. Now, how to establish a patent airway? There are non-invasive and invasive techniques. The invasive technique is a cricothyroidotomy. For example, if the object has gone back into the trachea and cannot be accessed by the McGill forceps, then we can go for tracheostomy or cricothyroidotomy, which is a medical procedure and needs to be performed by a medical expert. In the case of non-invasive procedures are Helminch maneuver, then the tongue sweep technique or the finger sweep technique on the tongue, then the manual thrust or the chest thrust. What we do in Helminch maneuver, we grab the patient from the back below the chest and make the patient bend forward and ask the patient to cough. This is the Helminch maneuver. And the finger sweep technique, we sweep the finger on the tongue so that the gag reflex initiated and the patient can cough off the object. In the case of infants, we give back blows to the patient, that is 5 back blows and 5 chest blows, and check the airway and repeat the procedure if necessary. This should be done at least 20 times per minute. Now, another dental emergency is asthma. All the asthmatic patients cannot be performed or go through the dental procedure because asthma is certain hyperirritability of the trachea or the bronchi or the respiratory tract to foreign bodies, and there's certain type of asthma like extrinsic, intrinsic and mixed type of asthma. So prevention is the first key to any asthmatic patient. We'll ask the patient to take the inhaler or the pump before any procedure so that the bronchial ways are dilated. The morning appointment should be kept. Good medical history or medical examination of the patient should be done. The stress from any dental procedure should be relieved by the various behavior management techniques on the patient, and every time the inhaler should be kept by side. For example, if the attack is there, we can immediately go for administration of the inhaler to the patient. Then there are certain medications which needs to be taken like barbiturates, opioids, aspirin and sodium bisulfite. For example, then if suppose there is an asthmatic attack during the procedure, first of all, the first step, stopping all the dental procedures, comforting the patient in the most comfortable position, then going through assessing the airway, assessing the breathing and the circulation. And next, the definitive treatment is that calling for any medical help or summoning the medical help, use of a bronchodilator. For example, that beta adrenergic blockers are used like adrenaline, salbutamol, acetbutanol, albuterol. Then we can also administer pure oxygen to the patient for establishing the respiration. Then we call for medical assurance. If the attack is still there or the patient has not retrieved to the proper comfortable position within 10 to 15 minutes, we go for administration of the intravenous bronchodilator, that is salbutamol or terbutaline, and transfer the patient to the hospital for further medical help. Now, what in the case of allergic reactions? Now, what is basically allergy? For example, if the patient is allergic to a particular allergen, first exposure, the patient will not show any allergic response, but on the second exposure, when the antibodies will be developed in the blood of the patient can show allergic response, which can be either immediate or delayed. The certain type of emergencies like anaphylactic shock, then cytotoxic, immune complex or cell-mediated type of emergencies. There are certain predisposing factors for such allergic reactions like for the dust, pollen, grains, etc. Sometimes certain patients are allergic to prawns, certain patients are allergic to certain dental fillings. So we can keep in mind that what the patient is allergic to, and we should not expose the patient to that allergen. Usually how the anaphylaxis progresses, there is angioedema, that is around the eyes there will be edema, around the lips will be edema, lips will be swollen, there will be hives or urticaria on the skin, there will be gastric upset like vomiting or diarrhea, even respiratory wheezing can be there or choking, sometimes even choking can be there. The cardiovascular symptoms include decreased of the cardiac output and the blood supply to the various extremities. Now, what should we do if the allergen or if the emergency has taken place? We can go for oral histamine blockers like epinephrine, which is 0.3 milligram, which can also be administered intramuscularly or subcutaneously. Then we should administer the patient for an hour, and intravenous steroids can also be given, an intravenous histamine blocker. Then we observe the patient for 3 days, and if the patient is still not fine, we can go for medical help. Now, there's one of the most common type of dental or medical emergency which is taking in a dental office is after administration of an LA, local anesthesia. If the administration is less than 4 microgram per ml, then no sign and symptoms will be there. If it is between 4 to 7, some slight signs and symptoms will be there, and if it is greater than 7, then severe signs and symptoms due to administration of local anesthesia will be there. Now, what happens in the excess dose of the anesthesia? First, there will be heightening of all the responses like cardiovascular or respiratory response. There will be increased tachycardia, trachea, and increase of pulse rate will be there. But slowly there will be decrease of cardiac output, decrease of the respiration, decrease of the heartbeat rate, and the patient can even go into the coma state. So prevention is the key. We should always measure the while before administration of the local anesthesia, and excess of anesthesia should not be given. In fact, proper technique should be employed for using the administration of anesthesia to the patient. Then before giving anesthesia, aspiration should be done, and the composition of local anesthesia should always be noted. We should also use adrenaline, which is a vasoconstrictor, mixed with the anesthetic. Now, what happens in the case of emergency? In the case of emergency by local anesthesia, first of all, we'll go for calming the patient. Then we'll access the airway of the patient. We'll see if the patient is breathing properly or not. Then we'll see for the circulation from the radial or the brachial artery, if the proper circulation is still maintained. And after that, we'll go for the definitive management, that is administration of oxygen, and the blood duct management should also be given. For in such cases, diazepam is a drug of choice in the case of local anesthetic overdose. So these were the medical emergencies which are encountered more often in the dental office, and the treatment for the same was discussed. Then epilepsy, which is one of the another major emergency which is taking in the dental office. For example, if the patient is epileptic and it is not notified by the patient to the doctor that the patient is epileptic, then there are more chances that epilepsy attack to occur during the dental treatment. There are various types of epileptic attacks like or epilepsy, which is a partial seizures, simple partial seizures, complex partial seizures, generalized seizures, tonic-clonic seizures, then myotonic seizures, then also absent seizures can also be there. Or there is a condition known as status epilepticus, which is encountered by the patient. The management of the patient with emergencies were first terminate the dental procedure, then make the position of the patient supine and prevent any injury to the patient by separating all the instruments from the vicinity. We should take in mind that we should not fix the extremities of the patient. For example, there is sudden jerky movement of the extremities, then we will not go for fixing the extremities. Rather, we will position the patient in the most comfortable position, and all the sharp instruments should be removed from the vicinity so that to prevent any injury to the patient. Then we will go for maintaining and assessing the circulation, the breathing and the heart rate, and any oral secretions which are occurred during this medical emergency of epilepsy should be removed by the means of aspiration. The patient should be moved in a lateral decubitus position, and if the seizure is greater than 5 per minute, we will administer anticonvulsant to the patient, that is diazepam in children, which is 0.2 to 0.3 milligram per kg intravenously, and the maximum dose is up to 10 milligram intravenously. In the case of adult, it is 1 milligram per kg, and maximum dose of 30 milligram should be given to the adult patient. So these were the management of certain medical emergencies in the dental office and the treatment for the same. It is very mandatory for the clinician to recognize any dental emergency which is taking place and act very swiftly as possible and go for the definitive care of the medical emergency. But it should not be overlooked that prevention is the key for treatment. Before any medical emergency should occur, we should go for the prevention of the medical emergency. Thank you.